Hi, I'm Michael, and this is California. And with the lockdown and the pandemic affecting all of us and shutting down a huge portion of American health businesses, there are still a few resources that have had an astronomical gain because everyone being stuck at home during the lockdown. One of these success stories is the rise in usage of telehealth. In the wake of the shutdown, telehealth services have been a huge growth in the last 4 months, especially considering prior to the pandemic, this was a service that most folks actually had on their health insurance, but never even considered using when they could actually go see their doctor in person. So today, we're going to talk about what is telehealth and what are some of the advantages or disadvantages of using telehealth for your healthcare. Now, before we do that, if you like this information, if you find it interesting, if you find it useful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. So let's first talk about what is telehealth. And it's a way for people to communicate with their doctor without having to go into the office. And really, it's been around for the last 5 years or so. But previously, it was mainly just talking to a doctor via phone. And in many cases, it was available 24 hours per day, regardless of where you were in the country. But it was primarily just used for urgent healthcare issues or overnight prescriptions for cold or flu or minor health issues. But with the increased usage of the smartphone, as well as the increased internet speeds and connectivity, people are actually starting to use it more with their smartphones and their iPads that connect to the doctor to do the visit face-to-face, using a live chat function like a FaceTime or a Zoom or a Skype or something like that. This has really expanded what types of healthcare services could be provided by a doctor via the telehealth. But even up to that point, it was still vastly underutilized until we all got stuck in this lockdown. And in fact, telehealth has seen a 4,000% increase in claims in the last few months. It has become very popular as populations who have been on lockdown still need to get their routine healthcare services. So like anything, there are advantages and there are disadvantages to telehealth. So let's talk about advantages first. So the first and most obvious is convenience. And so being able to do it from your home or while you travel or even while you're temporarily staying somewhere else, like if you're visiting grandma, you may not have to be limited by where you are to going into a physical office to get your health care. And really that is what's great as long as you have internet. So also travel time. So avoiding traffic, avoiding travel time saves a lot of time because you don't have to drive. And for seniors who may not be able to drive, even though they need to go check in with their doctor, it means they don't have to create any special arrangements to go see their doctors, which makes it a lot easier for them to get their health care and their health checks done on a weekly or daily or even monthly basis. Additionally, there's a practical benefit. You don't have to deal with any of the waiting rooms. You don't have to deal with any old magazines sitting around in the doctor's office. You don't have to deal with any of those weird doctor's office smell, or realistically sitting next to folks who may actually be really sick who are also waiting to get taken care of as well. It's also less expensive in time and in money. When we think about the doctor's overhead costs, if they are digital, it means that they can have less staff, less cleaning staff, and they don't need to have a specific medical office to be able to do it, which means less cost for the doctor and also means less cost for the patient. Also, there is privacy in the sense that when you're going to see this doctor over telehealth, you don't have to see anyone going to the doctor, you don't have to see anyone leaving the doctor, you don't have to talk to any of their staff. You're really just going to be talking with the doctor about your healthcare issues, which really cuts down on the possibility of other people seeing you doing your healthcare services. And then finally, not really having to go into a physical office gives folks in a rural part of America with traditional limited resources a great chance to have additional health resources that they don't normally have. Some of the disadvantages are that first, that folks would have to have fast enough internet, and lots of places across the US don't have fast enough or reliable enough internet services to be able to do telehealth. Also, people would need to be comfortable with the technology that is necessary to do telehealth. And in many cases, seniors or immigrant communities may have additional challenges with the technology that could limit their access to the telehealth service. As well as they gotta have a smartphone or a tablet, and those things can be very expensive. And the expense of those things would actually limit a huge portion of the population who really does need the health services, but may not be able to afford having any of those devices. And then finally, physicians may feel uncomfortable with giving professional opinions from a distance, finding it difficult to fully assess medical conditions if they're not able to touch any of their patients. Overall, telehealth may have changed the way that people utilize their healthcare, and it could be really good for some types of healthcare services, like minor things or antibiotics, or even mental health. It'd be really good for mental health, dermatology, or perhaps something as simple as pink eye. And I would love to see some integration of wireless health diagnostic tools into Teledoc. So things like blood pressure cuffs or other devices that could be tested and given the results to the doctor remotely. Now, for issues of accessibility to the devices, this can also be handled through the health insurance or through programs like Medicaid or Medi-Cal or Medicare. Those devices could be included automatically in the healthcare plans through those different programs. And in fact, many insurances here in California or through Covered California already offer Teledoc at reduced or free cost for most services that people can use. So it seems very likely and promising that expanded healthcare services will be great through Teledoc moving forward into the future. Thank you so much for watching our video, and I hope that you found it interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions, leave them down below. We'd love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can. Now, finally, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-Cal or even health insurance for a small group, we know health insurance because it can be very confusing coming out of your work insurance and going on to private health insurance. Or if you're turning 65, you're trying to figure out what are the best Medicare options for you. We can help you look at the different plans and the benefits that fit your needs as well as your budget. So if you have any questions about your healthcare, leave those down below. We'll make a new video or post for those as well. Now, other than that, I am Michael, and this is California, wishing you a happy, healthy day.